Welcome to the Cleveland Clinic Anesthesiology Residency Program video. We're honored that you have chosen us as an option for you to do your residency training, and we're excited to be able to share with you what our residency program is all about. My name is Carlos Trombetta. I am the Residency Program Director, and I wanted to welcome you to our residency presentation. And also thank you for your interest in our program. First off, we'll review how your interview day will go, including some key logistics and tips for you to ensure your success. And then I will go over some key aspects of our residency program that I want to highlight for you. So why don't we go ahead and get started? At the beginning of your interview day, you will have an introduction session where you will meet our coordinators and myself, and we'll be able to discuss the agenda for the session. That's a great opportunity for you to ask any questions about our program and for us to share with you the flow of the day. After introductions, we will go ahead and have the interviews. I will take a little bit more time later on to talk about these in a minute. Finally, we'll have a wrap up session where you'll be able to talk with me and one of the coordinators one more time to make sure that we address any questions that may have gone unanswered. And we'll have the opportunity to spend some time with our CA2s that can help address any additional questions. I always like starting by going over with you what the interview process is going to look like. I know that that is what is on most people's minds. You will interview with two of our staff and one of our residents for 15 minutes each. We usually have two teams interviewing in parallel. You'll get to know their names a couple days before your interview date when we finalize your thalamus interview schedule. In addition to that, I will have the opportunity to speak with you for 10 minutes. My time is a little shorter as I want to have the chance to speak with every candidate we interview that day. The purpose of this time during the interview is for us to be able to get to know you better. It's a chance for you to let us know who you are and for us to figure out if you're a really good fit for this place. It's also the opportunity to get to know us a little bit better as well, to ask us questions, and just as importantly, figure out if our residency program is a good fit for you. Because over time, I have come to realize that most successful residents in our program are those that fit properly here. Those who do thrive, take advantage of all the opportunities this program has to offer, and get themselves on track to become the best anesthesiologists that they can be. So, our job during your interview is to make sure that we get to know you a little bit more than what is on paper, and for you to get to know us a little bit better from what you read from us on the website, the brochure, and heard about us in the open houses. Basically, to determine if this is the place where you want to spend the next 4 years getting your anesthesiology residency training. I am sure by now you probably have had some experience with that Thalamus platform. It is pretty user friendly. One thing I would ask is that you ensure you have a good connection before your interview day. Once you log in that day, you basically just have to follow your calendar. You will be jumping from session to session so we can complete all that we have laid out for you with us that day. Just a reminder, make sure you hit the end button after each session. Otherwise, you'll be in this thalamus limbo and may have difficulty connecting to the next session. Please try to stay on time. I know that is what is going to keep our day flowing properly. As you're getting ready for the interview, make sure you're in a quiet place that is well lit, somewhere that you may not have many distractions. Please turn off notifications for all your electronic devices. Technology can be our friend, but it can also be our enemy, especially in the stressful situations. We have created 2 layers of backup plans for your interview day. If by any chance you lose connection to thalamus or you cannot reconnect, the interviewer you were talking to will have asked our interviewers to call you to that phone number you provided us. Make sure to keep that phone handy. If that were the case, you will receive a call from our office. Please don't think it's a robocall. The numbers are usually very strange, so I really cannot tell you right now what the number in your caller ID will look like. If you don't hear from your interviewer within a minute or so, call the number that I'm going to show here on the screen. If thalamus decides to die on us, we have also set up backup Zoom meetings. We will send out invitations to join them to the email address you have provided us. So if thalamus decides to crash, make sure you have access to the email account you gave us. Check out any invitations that may come up that way. One thing I always like to bring up, if by any chance your conversation with one of the interviewers gets cut short, and by the time you get to talk with them, it's already time to be done, we will have that interviewer recuse themselves from having an opinion about you if they feel that they did not get enough time to form a fair opinion. None of these interactions through your interview will be video recorded. Because we interview such a large number of candidates over such a long period of time, we determine how well we believe you will do in our program on the same day of the interview. By the time you meet all of us, we already have an opinion about you based on your application. We will complete our opinion after we are done talking with you. No video recording of any sort will be used later to determine your chances of making it to our rank list. And we expect you to do the same. By you agreeing to attend to our interview session, you're implicitly agreeing to not record us by absolutely any means, sound, video, or images. And we sincerely appreciate your compliance with this. Now that we got all the technical stuff out of the way, let's move on to discussing some key aspects of our residency program. As the leaves are changing here in the fall in Cleveland, let's change gears for a moment. Let's get us started in describing our program as we have a very interesting road ahead. I like starting our introduction session by describing the members of the education team. These are the individuals that you will have most interactions with during your residency. We have selected a group of faculty that over time have shown a great commitment to the education of our residents, and I am really happy to call our education team. First off, we have Avdeep Agarwal. He spends most of his time in the intensive care unit and some time in the general ORs. Next to him, we have Mariel Malapos. She is one of our general anesthesiology staff, and she spends most of her time in neuroanesthesia. She is diligently working on ensuring a great experience for our residency program once the new Neuro Institute building opens in 2026. Next to her, Harsha Nair, he will be your point person when you come in as interns. He spends most of his time in the orthopedic ORs and as staff in the acute pain service. And finally, we have Sandeep Khanna. He divides his time between the general anesthesia ORs, where he does livers, and in cardiac anesthesiology. Finally, we have two individuals that are both great guys, and I am very happy to call my bosses. Dr. Argalius is the prior program director, and he is now the chairman of the Department of General Anesthesiology. He continues his role in education as the vice chair for education for our department. And finally, Dr. Troyanos, a very accomplished individual, is our anesthesiology department chairman. Please take a moment to review his welcome video that he recorded for all of you. Some of you already have met our chiefs. We have two in the CA3 class, Forrest and Garrett. Next to them, we have Serena and Chris. They are our two junior chiefs. I'm extremely grateful for all the hard work that they have put in making sure that this interview season is a very successful one. Now, let me share with you a little bit about the Cleveland Clinic and what is it that we're all about. The foundation of the Cleveland Clinic, 100 years patient-centered care, began with the hospital physician founders. After caring for wounded soldiers in World War I, Dr. Bunce, Cryle, Lauer, and Phillips believed in teamwork to serve the welfare of our patients. Their credo was to act as a unit, which became the founding ideal for the Cleveland Clinic. Over 100 years later, the organization remains a team of teams focused solely on the patient. Our mission of caring for life, researching for health, and educating those who serve evoke the past, the present, and the future of our patient care. Our innovative culture and commitment to the patient experience have gone hand in hand with our dedication to research and education. Our history shows that it will continue way into the future. What started as a unique group practice over 100 years ago has grown into a global organization with locations in Ohio, Florida, Nevada, Toronto, Abu Dhabi, and London. Today, Cleveland Clinic's over 60,000 caregivers deliver compassionate care and exceptional care to more than 2 million patients worldwide. Our care priorities are quite clear. First, we take care of our patients. The care of our patients is that if is they were our own family members. The Cleveland Clinic here is for one reason, to take care of patients. Regarding the care of our caregivers, we treat our fellow caregivers as if they were part of our own family as well. There are over 60,000 Cleveland Clinic caregivers around the world. We're the largest employer in Northeast Ohio and the second largest in the state. We promote teamwork, inclusion, and integrity. We strive to make Cleveland Clinic the best place to work and grow in healthcare. When we think about our impact on the community, we are committed to the communities we serve. Our benefits go beyond healthcare services. We promote the physical and economic health of our neighborhoods. We are building a future of health education and workforce development that will enhance the region for generations to come. And finally, we treat our organization as our home. Cleveland Clinic is a nonprofit organization. All our revenues beyond expenses are reinvested in our mission. In line with Cleveland Clinic stands for, our residency program shares its values. Our values are very specific. First, quality and safety. We ensure the highest standards and excellent outcomes through effective interactions, decision makings, and actions. We value empathy. We imagine what another person is going through, work to alleviate their suffering, and create joy whenever possible. We value inclusion. We intentionally create an environment of compassionate belonging where all are valued and respected. We value integrity. We adhere to high moral principles and professional standards by a commitment to honesty, confidentiality, trust, respect, and transparency. We value teamwork. We work together to ensure the best possible care, safety, and well being both of our patients and our fellow caregivers. And we immensely value innovation. We drive small and large changes to transform healthcare everywhere. So, how does this apply to a residency program? Housed within our institution and the anesthesiology department, we at the residency program share these core values and guiding care priorities. We believe our residents deserve the best work environment where they can thrive and become outstanding anesthesiologists. That our patients deserve to be treated with the most quality care, with empathy, and with respect. We understand that by recognizing the strength of our differences, praising our diversity, and encouraging inclusion, we all grow to be better people. And we understand that teamwork and innovation are important keys to our residents' success. We help share these values with our residents so they can make them their own and eventually take them when they're done with their training here with us. When you decide on a residency program, you have to identify their mission and vision. In our case, our mission and vision comes down to making sure that we can provide society with the best possible anesthesiologists that can help serve it. Our mission is to train future anesthesiologists that are leaders in their field, leader in their private practices, leader in their subspecialty societies, leaders in research and education. We also want to make sure that we have the best possible anesthesiology consultants. That when our residents are done with their training and go out and practice, people come up to them and ask, "How did you do things at the Cleveland Clinic?" That you feel confident about standing in front of any surgeon, any surgery, or any patient and being able to effectively, safely, and confidently take care of their anesthetic management without any hesitation. When you think about it, these are two pretty big goals. The way we have to live up to these challenges, and we believe we can accomplish them, is by providing our residents a rich learning environment, an outstanding clinical experience based on the management of very complicated patients, high repetitions, expert-based feedback in the context of a great educational and research experience. That is how we can live up to that mission. Let me share with you what I mean by an outstanding clinical experience. We have a pretty big campus here. We have a lot of ORs and a lot of hospital beds, making us the main center for quaternary care in the state of Ohio. And although our size is important, our reputation is even more. Every day, more and more patients are attracted to receiving their care here at the Cleveland Clinic, both in the state of Ohio and many neighboring states, and for that matter, all over the country and the world. Our reputation allows us to manage the most complicated patients undergoing any type of surgical procedure imaginable. For the most complicated things to the simplest ones, our residents get a huge exposure to all spectrums of surgical care. That is how we can assure that when you're done with your residency, you'll be able to take care of pretty much anything that stands in front of you. We have a lot of ORs all over our campus, pretty much one in each one of these buildings. I know it may seem overwhelming, but I just want you to understand that when you're in one of our particular rotations for that month long, you will be only in that particular surgical area. As I said, yes, it's a big campus, but we make sure that the way we schedule your rotation gives our residents the appropriate exposure to ensure that they are taking the best from each one of these individual areas. Another important aspect of our surgical specific rotation model is that while you're in a very single one of each one of those rotations, you will have the opportunity to work with world-class anesthesiologists subspecialists in these areas. Are the ones that have written book chapters and where we all study from. I think what makes our staff anesthesiology group very particular is the fact that they're keenly subspecialized. What I mean by that is that they spend most of their time in the same surgical subspecialty, almost like what you have seen in other hospitals for pediatric anesthesiologists that just do pediatrics. Well, our orthopedic anesthesiologists here mostly do orthopedics, and that model repeats itself over every surgical specialty. When you think about the future and who do you want to train with, having this setup will benefit you greatly, as you will have your efforts concentrated in one area at a time, get to see all levels of complexity with these kinds of cases, and will work with world renowned experts through them. You're going to be learning from somebody who has seen that case many times before, has tried different ways of managing it, and is comfortable and able to guide you to make sure you're good managing it too. And not just one, but you will be working with several anesthesiologists in each one of these particular services. So you'll get the different perspectives that all these experts can share with you to make sure you're a better anesthesiologist. Now multiply that by every single subspecialty that we have here, and that's what the quality of your education you will get when you go through our program. Not just in pediatrics or cardiac like other places, but in every single surgical subspecialty. In a nutshell, what we're offering here is the opportunity for you to work in a quaternary care center where you'll be exposed to a great variety of procedures from the simplest to the most complicated and rare ones, while you have the opportunity to do similar cases over and over under supervision of subspecialized anesthesiologists that can give you real-time feedback and guide you as you get better at doing them. And probably the best way of describing this experience that you will have here with us. Although we understand that getting through residency program is not easy, we have to ensure that our residents get help through the way. When you train here, we want to make sure you feel guided and mentored from the beginning. We have established a mentoring system that will connect you with faculty staff every single day from your internship year. Creating this connection will allow you to understand the multiple parts and pieces that will make your residency most successful. Anything from how to study, where to study from, what to do to get better, and what to do with the feedback. Residency training is pretty difficult as it is, and we believe there's no need for you to do it all by yourself. That's why we have such a robust mentoring system here. When we pick these mentors, we get faculty that are fairly early in their careers, and it can help you navigate your residency in the best possible way. We also have established a peer to peer mentoring system in our program. We have created a structure that connects residents with similar interests, allows them to provide mentorship along the way. Just think about this for a moment. It's going to be a whole lot easier for you to ask somebody how to set up a room or what to expect when working with a particular staff if you have a personal connection with them and know exactly where to go and who to ask when you have a simple or basic question. Now, I want to spend a little bit of time talking about our education experience here at the residency program. The road to becoming an anesthesiologist is not always straight and clear. Let me share with you what we believe here at our residency program is the best way to get you there. Just like most residency programs, we're a categorical program with our clinical base year followed by our 3 clinical anesthesia years. Let's spend a little bit of time talking about each one of these academic years. We should probably start talking about our clinical base year. Here's a list of the rotations that you will be doing while you're here with us in our program. You will be spending some time in medical service rotations. One thing that I think is very distinctive about our program is the way we approach our consult service. The idea is for you to spend a month in these medical subspecialties, understanding the questions that these subspecialties get asked for help and how you could answer them when you are the anesthesiologist on the or the intensive care doctor asking them. You'll have a clear understanding of the way our subspecialty colleagues think. During your internship here, you're also going to spend a lot of time under supervision of anesthesiologists. You'll be part of our acute pain service. You'll rotate through our SICU. And you'll spend some time in the chronic pain recovery area where you'll help understand all the complications associated to chronic pain medication use and ways to help patients overcome them. You also be part of the preoperative medicine team, watching the progress of these pre-op patients all the way from their pre-op area to their post-op process. You will also spend some time in actual anesthesia OR rotations. During these modules, you'll get your introduction to the ORs. 2 months of your orientation modules will have intensive anesthesiology training with one-on-one assignments with senior residents, multiple lectures, a boot camp simulation curriculum, hands-on workshops, and a highly supervised environment. After these 2 intensive months, then you'll go to the general anesthesia rotations where you will be managing your own cases. Mostly simple and straightforward ones, but as you slowly start to develop your own management strategies and personality in the OR. There's a lot of supervision, but now you're sitting your own cases. Although these are the simplest cases you'll ever do in your residency, it's probably the most important time for you to learn the basic strategies of anesthesia management. Then you move on to the CA1 rotations. We honestly believe that the early internship anesthesia exposure allows you to transition to your CA1 year in a seamless way. As you heard before, you will be rotating through the different subspecialties areas in anesthesia. At this point, you'll be exposed to simple and not so simple cases and manage them with your staff to make sure you develop very well in each one of these areas. You'll spend some time in our acute pain service again and our intensive care unit again. As a more senior resident, you'll be managing more complicated things in both those areas. Additionally, you'll have the opportunity to spend a month in the pre op anesthesia clinic and our post anesthesia care unit rotation, where you spend a lot of time learning the management of patients in their preoperative period. We have recently transitioned our chronic pain medicine to our CA 1 year. This will give our residents an early exposure to this great subspecialty. And finally, you'll have to spend some time in our cardiovascular intensive care unit, will you be taking care of post-operative cardiac surgery patients, and in our cardiology service, will you be part of their consult team? A pretty comprehensive CA 1 year for our residents. In 2026, we're anticipating opening our brand new Neuro Institute building. It's projected to be one of the largest in the country. We foresee your experience there will be without par. With 12 new ORs and procedure rooms, 25 ICU beds, we'll be able to provide our residents with a great clinical experience. By the time it's completed, you'll be able to do your neural spine and neural rotations as a CA2 and as a CA3. Now let's spend some time talking about our CA2 year. It's an outstanding experience that our residents have as they get additional exposure to sub anesthesia care. Here's a list of our two CA2 rotations. I want to take a moment to highlight some of them. You'll have the opportunity to rotate through our cardiac ORs. The Cleveland Clinic has been recognized as the country's best heart center for 30 years in a row. During your CA2 year, you're going to be paired with a CTA fellow and you will be managing the most complex cardiac cases. This will set you up to manage them by yourself when you return to the rotation as a CA3. Our pediatric anesthesia experience is without par. You'll be spending time in our main campus anesthesia area where you'll have great educators teaching you the basics of pediatric anesthesia. Also, as a CA2, you'll be part of our liver transplant team, recognized amongst the top 5 liver transplants in this country. You'll be able to have a great experience managing these very complicated patients. You'll also go back to the SICU and spend some more time polishing your regional anesthesia skills in our acute pain rotation. And while you're in the general ORs, you'll be managing more complex and challenging cases. And finally, you'll have your CA3 year. During the CA3 rotations, you'll have the opportunity to go back to some of our subspecialties, but now in a senior capacity, getting more complex cases and autonomy. Here's a list of the CA3 rotations. There's a couple points I want to highlight. When you go back to the general anesthesia ORs, our residents get the opportunity to choose what services they want to be a part of. Go back to the heart center, well, you'll sit your own cardiac and complex vascular cases by yourself, and you'll have a full designated month to learn TE. Many of our residents embark on obtaining basic certification as they get enough numbers, clinical exposure, and education to be successful with this board certification. You'll also have the opportunity to rotate through different hospital sites all over the city to enhance your autonomy and management strategies. As you know, the Cleveland Clinic does not have a trauma center attached to it. We encourage our residents interested in trauma in engaging in a rotation at the Akron General Medical Center, part of the Cleveland Clinic health system. And if you're thinking about enhancing your pediatric experience, we have some of our residents join the congenital teams here at the hospital. We believe the CA3 year is a time for our residents to explore different areas of their interest and go back and fine tune their skills and their proficiency. We also understand that it's not all about clinical experience. In anesthesia, you have to back it up with formal and structured education. Let me spend a moment here talking about the basis of our educational experience. Here are the most important components of our education. We'll go and discuss each one of them one by one. Through your residency, you'll have an academic half day on Thursdays that will allow you to dedicate specific time in making sure that you invest in your own education. This is when you'll have your lectures, your simulations, workshops, and that's when you're going to spend most of your education. If you think about it, you will spend 10% of the time in residency dedicated to your education. In addition to that, on Wednesday mornings, we have our academic grand rounds where we invite staff from all different subspecialties to present interesting and challenging cases so we can discuss their management and learn from them. Additionally, we invite visiting professors on a quarterly basis through the year that they can share their expertise and knowledge with our group. And in addition, we have different departments that will host service-specific PBLD sessions as well as keywords and multiple choice question sessions. With our procedural simulation and cadaver labs, we allow you to have the opportunity to learn by doing and understand the steps, indications, and complications of every procedure that you will be learning during residency. We believe that through delivered practice, we can definitely make our residents much better. Here are some examples of our simulation sessions. I understand the importance of making sure that our residents develop the skills necessary to effectively manage crisis in the ORs, allowing our patients to get the better chance of surviving during their crisis. The way we do this is by increasing the complexity of the simulation scenarios through your residency time, having at least 5 to 6 different simulation exposures per academic year. We want to make sure that you're successful in your board certification process. We do mock oral exam practice sessions periodically through every academic year, and then we ramp it up in your CA3 year. Having actual board examiners as part of your faculty staff allows our residents not just to have that experience, but just have one that is very similar to the real thing, making them very successful. Again, we make them progressively more difficult for you to feel more confident about them when the time comes around. We have created two different OSCE sessions for our residents. You have the opportunity to have difficult conversations as you practice to develop these skills that are crucial in the real world and help you be successful in your applied portion of your board exam. We have sessions for our CA1s, CA2s, and CA3 residents. We believe this longitudinal approach allows our residents to progressively get better at having these difficult conversations with their patients. And in addition, help guarantee their success when they're taking their OSCE portion of their ABA applied exam. We believe that our longitudinal curriculum effectively prepares our residents to be successful in every step of their board certification process. Our board certification rates here are over 90% for our graduates. We also believe in the opportunity to train our residents in multiple areas of point of care ultrasound. We believe that today's anesthesiologists have a great opportunity to be able to learn and understand ultrasound as a great tool to help us manage our patients better. Through the residency, we have identified several rotations where our residents will have clinical exposure to allowing them to practice what they have learned in the different lectures and the different workshops. We also have a wellness curriculum. Every quarter, you'll have a designated wellness half day that our residents use for a great number of things. In addition, we have our wellness day sessions where we provide our residents with tools to help prevent burnout, work on resiliency, and promote well-being. I decided to add a little bit of conversation regarding where our trainees go after they are done with residency. I went through the data for over a decade and found that approximately two-thirds of our residents continue on to some form of subspecialty training. As you can see, the trend has varied a little over time, but it also seems very consistent. This is a distribution of the fellowships that our residents move on to. As you can see, it's been pretty variable over the years, but commonly they will go to CTA, SICU, chronic pain, and PEDS as their main destinations. Let's talk a little bit about the time off while you are in residency. You will have 20 academic days off, so 20 vacation days that you'll have through the academic year. Funding for meeting attendance will come through the Graduate Medical Education Office. Our residents will have the opportunity to go and present in meetings which they have submitted their work to. This year we have 49 residents attending the ASA meeting in Philadelphia. They're presenting 59 abstracts. I'm really proud of all the hard work and efforts that they have done to get themselves there. In addition, we have our local and regional meetings. The Ohio Society of Anesthesiology meeting was just passed, and the upcoming MARC or Midwest Anesthesia Residents Conference are meetings that are really well attended by our trainees. We are looking forward to participating in them next year. In addition, there are other perks of being a resident in our program. All our residents will get a mini iPad and a subscription to all the services that I am listing down here. Although our residency program is not fully affiliated to a medical school, we get students from Case as well as from Ohio University. As part of the Cleveland Clinic, our program is bound to the Graduate Medical Education Department here at Cleveland Clinic, one of the biggest in the country, with over 100 accredited residency programs and fellowship programs, and over 150 non-accredited ones. Their office is actually really busy. They will be your employers during residency. They're the ones that provide employee benefits and packages that are most comparable to most major universities. We have their benefits document available for you to see on our Talmus page. Through them, you will have insurance for yourself and for your immediate family members at lower costs than our regular employees. You'll also have access to our fitness center that is on campus, and support from our House Staff Association and a very busy House Staff Spouse Association. As you're looking forward through this interview season, I want you to look into the future and try to realize if we can be a part of it. Residency training is a very important part of your personal and professional career, and I want to encourage you to find the best place where you can successfully take this on. I sincerely appreciate you considering our residency program as the place where you want to start your professional career and look forward to meeting you during your interview day. Our interview committee was very thoughtful in selecting your application as we believe you would be a great match for our program. During your interview, we will have the opportunity to learn a bit more about you, and hopefully by the end of that day, you'll be able to understand what our residency program is about and how we can help provide you the best possible training. If you do have any questions, please feel free to email me or at the general residency email address or my personal address, and I'll be happy to answer any emails or questions that you may have for me. And on the day of the interview, we will have the opportunity to meet in just as one of the initial sessions where we are going to be able to answer your questions as well as the individual time that you will have with me during our interview and in the wrap up session later on. Plenty of opportunities to address any questions that you may have about our residency program. I sincerely appreciate you considering our program to pursue your anesthesiology training. I hope this video was informative. Thank you again for your interest, and I'm looking forward to meeting you very soon.